welcome for another exciting interview with the Fits on the Go. My name is Norma Gamarra, and I'm currently the co-chair of the medical student member community. Today, I have the honor to have here with me Dr. Rhanderson Cardoso, who is a clinical cardiologist with an expertise in cardiovascular imaging in Boston, Massachusetts, and is affiliated with the Brigham and Women's Hospital. Dr. Cardoso, we are so happy to have you here.
Thank you so much, Norma. It's an honor for me. I want to thank the FIT committee for the opportunity also to talk about our study.
Thank you. So today we're going to talk about the CAVS trial, which Dr. Cardoso is pretty much involved. So doctor, could you please explain us what is this trial about?
Absolutely. So the CAVS trial serves a very simple purpose to evaluate whether lowering lipoprotein little a with pelacarsen slows down the progression of mild to moderate aortic stenosis. So as you guys know, aortic stenosis is a really clinically important, a very relevant clinical problem. And pretty much what we have is the aortic valve replacement, which is done at a late stage in the disease, whether surgically or through transcatheter aortic valve replacement. And many studies have examined whether different therapies can slow down the progression of aortic stenosis to the point where patients may not need aortic valve replacement, but everything's been unsuccessful, including, for example, statins. So there's a lot of links, a strong association between elevated lipoprotein little a and aortic stenosis. And the goal of the trial is to see if lipoprotein little a lowering will slow down the progression of aortic stenosis.
Okay, and how do you think the results of this trial are going to impact on our clinical daily practice?
Right. So the trial is designed with it's 3 years follow-up. And patients are being recruited on the basis of having a high lipoprotein little a, above 175 nanomoles per liter. And they have to have a very specific range of aortic stenosis, mild or moderate. It can't be too early in the disease process where it would take too long to see any meaningful benefits. And it can't be too late, at which point there would be no point in intervening and patients need valve replacement. So the peak velocity has to be between 2.5 and 3.5 meters per second, and those patients would be randomized 1-to-1 to pelacarsen versus placebo. They're followed with a echocardiogram at baseline and every year for 3 years, and they're followed also with a CT scan to look at aortic valve area and some other components of the aortic valve by CT at baseline and follow-up at the end of the study at 3 years. And getting back to your question, the goal here, if this really slows down the progression of aortic valve stenosis by these surrogate endpoints, by aortic valve velocity on echo, by cardiac CT parameters, then of course the goal would be to do a larger clinical trial powered for clinical endpoints, and then hopefully then have a drug that actually works for slowing down aortic stenosis. So if this works out, if the hypothesis is proven, I think it'll cause a huge impact in the sense that there's 20% of the population has elevated lipoprotein little a. Aortic stenosis is widely prevalent. So once we identify those patients at an older age who have mild to moderate aortic stenosis and elevated lipoprotein little a, we'd be able to potentially prevent progression of the disease.
Okay, that sounds really interesting, and it sounds like we are going beyond to the clinical practice and also to take care of our patients. So just to finish the interview, what advice would you give residents and fellows to get involved on trials like this?
Yeah, so a trial like CAVS, for example, is a multi-center trial. I'm the site principal investigator at Brigham, one of the centers for this study. And fellows can definitely get involved if your institution is a part of this of the network. In this case, it's a Novartis-run trial. So any fellow who would be interested, for example, at our institution at Mass General Brigham, who would like to be involved, could directly reach out to me. It's a little tougher for fellows who are outside the center where the trial is being done. But then again, in the U.S. specifically and other places around the world, there, if not this trial, other trials that are being done locally, and fellows can help with identifying patients, recruitment, follow-up of these patients, and that's definitely an avenue for research for fellows and trainees.
Thank you so much for this amazing interview and your time, doctor. And please, for more interviews like this, check out our YouTube channel at youtube.com/FITsOnTheGo. Thank you.
Thank you.